afternoon, everyone. All right, welcome to today's lunch at NIBA. Today we have an interesting presenter that's talking about current events that are coming around. First, I do have two announcements I want to update, so if you guys can just listen up for a second. All right, two things I did miss on this morning that I would like you to keep notice on. We are sending out, a part of the membership committee, a top 10 list of questions for all the members and associate members to answer. So when you do get that, please fill that and send it back. We will be sending that out weekly, updates that each of the firms will have their own highlight, and everybody will get notification on that, and you can just answer those questions and you'll have that free PR there to say, what is our firm doing, what kind of deals do we like to handle, what are the largest deals that we have handled, et cetera, et cetera. In addition, I also want to thank everyone that came out to last night's orientation. That was the first formal orientation that we actually had, and I think it was a pretty good success, and we're looking forward to make this more formal as we move into Vegas and have a bigger following with that. In addition, I'm going to move on now to our speaker. Mark DeRosa is the founder and president of VantagePoint Benefit Administrators. He's also on the Ben Exchange platform here. In addition, today he's going to be talking about some of what happens with the new healthcare reform moving forward. His firm specializes in design, implementation, and management of employee benefits and insurance programs. Mark is a certified New York State instructor in the field of alternative premium fundings and IRS benefit-related tax codes. Prior to forming the VantagePoint in 2003, Mr. DeRosa spent 13 years working for industry leaders such as Empire Blue Cross Blue Shield, Group Health Incorporated, and Precise Benefits Administrators. Mark's given this speech several times throughout the year so far, and we thought it'd be a huge asset to come and talk to you guys today to get you guys ready for what's going to happen come October 1st, and also what's going to happen in September in 2014. So I'd like to hand it over to Mark, where he takes you through the rest of lunch.
Thanks, Tim. I was hoping to do this earlier this morning, but I don't want to do this while people are eating because this topic might make some people a little sick. But we're going to try our best to get through this because every single person in this room is affected by Obamacare. We'll see if that turns into a four-letter phrase in the future, but indications are so far we're heading down that path. So let me just jump in quickly, just so I can tell everybody, this presentation will be available. You can just email our office. I've given out some brochures on all the tables. Ryan from my office is here. We'll be here a little bit after the show. If anybody has any additional questions, assistance, or wants to get copies of the presentation. So let's just talk about what our government does and how they spend things. If you look at the first question, you go to the White House website. First question, will my taxes go up for the cost of covering the uninsured? And the White House says no. I beg to differ. I'm not going to get into the details, but you can see all of the different taxes that are now part of the bill. This bill, believe it or not, is now recognized as one of the largest tax bills ever passed in the history of this country. But when is a tax not a tax? When you don't call it an income tax. There are fees, there's surcharges, there are excise taxes. Okay? Is the government going to make their introduction into health care simpler for everybody? According to the government, the answer is yes. Looks pretty simple. My 8-year-old put that together. I take that back. Actually, the White House put that together. So let's talk about what's going to happen for 2014 for every employer, small or large, in the country. So a number of things already happened in 2013. When is a tax not a tax? Let's put caps on tax advantage programs. Flexible spending plans are limited. When does an employer lose money? When they lose productivity due to compliance requirements. Now they have to do W-2 reporting. Creation of SPCs, which is a brand new summary of benefits Even though the insurance companies have a very good format, they can't use it anymore. We have to use the government format. Creation of the new notices that have to go out to everybody, that is an October 1st deadline. Has anybody gotten it from their employer yet? The notices about the exchange, October 1st is the deadline. Something new that an employer needs to do for everybody. Every time you hire a new employee, it has to be distributed within 14 days. More compliance nonsense for the employer. So we're going to talk about the creation of these public and private exchanges that the government's spending a lot of time on. We're going to talk about the play-or-play mandate, which was just delayed until January 2015. But large employers, as we define larger than 50 employees, still needs to do work beginning in January. I'm not going to spend too much time on the future beyond that, but in 2018 is the infamous Cadillac tax, which is a 40% excise tax on the value of the benefit that your employer gives to you. Most companies are already at the limit. So you can imagine a company that's paying $1 million in benefits. They're looking at a 40% non-deductible excise tax unless they restructure their plan or they get out of the business of offering insurance to their employees. Again, I'm not going to go through all the details in this, but from a political perspective, Obama was brilliant. When the bill was passed in 2010, all the way through 2013, he added a number of new benefits that every plan had to include. No more pre-existing conditions, coverage of kids up to age 26, no more annual or limit caps on overall benefits. All sounds good on paper from a podium from a politician's perspective, but all of these things have added cost the last 3 years. Has anybody seen a rate decrease the last 3 years? Don't think so. Okay, this is another part of why rates continue to escalate. Obama catered to the senior market in this country and did a number of enhancements to the Medicare program, but in many respects took a lot of programs away that worked very well for the low and middle income people. Grandfather plans. If everybody remembers, one of the biggest things that Obama said was, if you like your plan, you can keep your plan. It's what they call the grandfather plans. Except the only way you were able to keep your plan is if you made no plan design changes whatsoever in the last 3 years. If you change your copayment from 10 to 15, you lost your grandfather status. And once you lose your grandfather status, you're now subject to every penalty, every provision, every compliant requirement. A bunch of money is going to the wellness programs. Anybody saw the New York Times this week and on Sunday? There's a lot of issues going on with wellness programs. It affects the ADA, Americans with Disabilities Act. We're already starting to see a lot of chatter in the employment law community about lawsuits with regard to how a company implements a wellness program. Does it satisfy ERISA? Does it satisfy ADA? Am I doing it in a discriminatory manner, and am I leaving myself open to a lawsuit? This is a very, very big issue. The government's not looking at this at all. They're looking at this and saying we're giving a nominal credit for companies to offer wellness programs without understanding all the implications. Let's talk about all the things that have to go into everyone's program, regardless of the size of your employer. Every program now needs to include what the government has defined as a minimum health essential benefit. There is a maximum out-of-pocket that all plans can have. Now, the problem with that is maximum out-of-pocket scenarios is what the insurance companies use to help keep costs down, keep their rates down. The government basically has just put a price control into the industry by putting in these out-of-pocket maximums. They've also adjusted how an insurance company is able to underwrite their own risk. They made it more difficult for them. What does that mean for everybody? It means that the floor is being raised, which means higher premium for everybody. Just very quickly, let's talk about how we define small employer. The funny thing is, there's many components in the law where the same type of company is completely defined differently. So small employers, depending on what provision of the bill, sometimes they're considered employees with employers less than 99 employees. Other times it's for employees less than 50 employees. But from this perspective, we're talking about, again, health essential benefits, a cap on the deductible, the highest deductible somebody can have, and again, on the maximum out of pocket. Now, for people that are here in New York, one of the most popular programs in New York is a program from Oxford. They sell a deductible plan. Their deductible is $2,850 and $5,700 for a family, and as you can see, the cap is now 2 and 4. That plan at $2,850, $5,700 on renewal this cycle is pricing out at $650 a month for a single. They can't renew that. Oxford has to take that product outside of their portfolio and lower their deductible. So what does that mean? You're going to start seeing single rates in the mid-7s. Large employer. Waiting periods can no longer be more than 90 days. Self-insured plans, which a lot of large employers take advantage of, do have some relief. They don't have to abide by all the ramifications of the bill, but a big portion of it. And one of the things that they cannot veer away from is they are also subject to the out-of-pocket maximums. We're hearing a lot of chatter in the self-insurance community. I'm very concerned with that. Individual mandate. Everyone's heard about this. This was what the Supreme Court decision hung their hat on. It was about the individual mandate. When is a tax not a tax? When Obama doesn't call it a tax, or the Obama administration doesn't call it a tax. Okay? This is a fee. And if you see at the bottom of the slide, if I did not buy insurance this year, I have 3 ways to buy insurance. I can buy it through my employer. I could buy it through some kind of government program, Medicaid, Medicare, Family Health Plus, any type of state-run program. I could buy it through the individual exchange that comes live January 1st. If I do not buy insurance, my penalty is $95 in the first year. Considering that health insurance is much more than $95 a month, the acceptance rates of people going out and buying insurance that are not currently insured is pretty low. The penalty does increase in the future. But again, is it enough to compel people to buy insurance? We'll have to wait and see. And I gave an example here of what the taxable penalty will be if a single or a family chooses not to obtain insurance. Again, in 2016, in a couple of years from now, it does get pretty pricey, but still certainly much more affordable than actually going out and buying the insurance. If anybody has any questions, you can ask as I go. Slide's a little bit hard to read, but there's a decision tree. So the public has all these decisions that they need to make. I, as an individual, have to make decisions, and depending on my decision will lead me down a different path. Me as an employer, as an owner of a small business, I have decisions that I need to make, and my decisions will directly affect my employees. In many respects, it might hurt my employees. In very few instances, it might help them. If I'm a large employer, I have my own decision tree. These are all new things. All of a sudden, employers, it's the last place an employer wants to be. In the game of deciding what type of insurance, when to offer insurance, how to communicate that insurance to my employees. The amount of time and effort and cost associated with this is quite high. So let's talk specifics. I'm an employer less than 50 employees. I do not have to offer insurance. But if I do offer insurance, I have to abide by all the other restrictions, the waiting periods, the maximum deductible, the maximum out-of-pocket expense, all the notification requirements I'm now subject to. I can opt out and not offer anything to my employees. But now you might have a recruitment and retention issue on your hands. Because if I don't offer insurance, then my employees only have one place to go, and that's the government exchange on the individual platform. And if you're in a state that's not doing their own exchange, the government has one plan to choose from. Could have sworn Obama said there would be choice. I'm an employer with more than 50 full-time equivalent employees, and we'll get into the definition of full-time equivalent because that's a whole, you need a master's degree to figure that out now. I'm a large employer. I have to offer insurance. If I don't, I'm going to pay. I'm going to pay a non-deductible excise tax of either $2,000 or $3,000, depending on what I end up doing. Again, I don't have enough time to speak today to get into the details, but I just want to touch on some key points with this. Like I said before, this penalty provision was delayed until January of 2015, but it's not going away. And now's the time for employers to start planning for it. Like I said before, I'm a large employer. I choose not to offer insurance. I am now paying a $2,000 non-deductible excise fee per benefit-eligible employee. I get an exclusion on the first 30 of my full-time equivalents, but then I pay that $2,000 for everybody else. So here's an example. Not a very large company, 100 full-time equivalent employees. They're looking at a $140,000 non-deductible excise tax. What if I'm a large employer and I do offer insurance? Well, I could do that, but then I have other restrictions put upon me by the government. I have to make sure that my plan meets the actuarial minimum value. What is an actuarial minimum value? Well, the CMS.gov, Centers for Medicare Studies and Services, has the calculator for you. It's 34 pages. You could figure it out if you like. But if my plan is not affordable, I'm concerned about this. If my contributions that I ask for my employees is more than 9.5% of their household income, I'm still subject to the penalty. So that's another calculation I need to do to factor this in to make sure that I meet this. Now here's something very important. It's very similar to, my analogy on this is very similar to 5,500 on retirement plans. Employers are used to having to track information throughout the plan year and then report it annually in a new tax schedule. It's the same exact with this. The government is requiring every employee to track this information on a monthly basis and then report it as a new tax schedule. Okay? Employers will need help. They will need to find somebody who provides these calculators that can help them track this. It's more than just payroll. It's the payroll piece. It's the benefits piece. I've got to track marital status. I've got to track who's enrolled. I've got to track the pay. I've got to track what the cost of my program is. And then, oh, by the way, what if I have hourlies? What if I have hourlies where they might work 20 hours a week, and then we have a busy time of year, and now they're up to 32 hours a week. I never had to track them before, but now I do. A lot of extra work for an employer. Well, now we finally come to the oasis in the desert. I'm a large employer, and I do offer affordable coverage, and I do offer the minimum value. I'm in luck. I'm not subject to a penalty anymore. But I probably have to pay more towards the insurance because I have to make sure my contributions are high enough to keep this threshold. And like I said, not all of us have white-collar, salaried employees. A number of us have hourlies. It still has to be tracked. A lot of tracking has to be done as part of this new law. Any questions? Yeah. Well, you would think that the excise tax would go to improving the health overall of this country, but it's actually in the bill that it goes into the general operating fund, and it can be used at the discretion of the government in any fashion. Okay? The other thing that's also interesting to point out is this is all driven by legislation. So we're at, I hear various numbers, but the most conservative number is we're already, since January, 60,000 new pages of regulations have been issued since January. And the head of the HHS, Kathy Sabellis, she can make unilateral decisions that affect each and every one of us in this room without any oversight. She's not elected, and that's the position, that's the authority within that position. One person. The whole issue with the contraceptives, if you remember, that was back in spring. Contraceptives. That was Kathy Sabellis. That was her personal belief. The only reason it was modified is because of the political backlash, and then President Obama got involved. But the reg that came out on a Friday afternoon was from her. More tracking that an employer needs to do. How do I define a part-time employee? How do I define a full-time employee? Believe it or not, there's actually 4 separate definitions of a full-time employee within the bill. When am I using the right definition? And if I make an error, am I subject to a penalty? And the answer is yes, unfortunately. So what's one of the things everybody said when the bill first came out, all large employers? I'm out. I'm not doing insurance anymore. My employees are on their own. And then we said, well, you're subject to a penalty. All right, I'm out. I'm making everybody work 29 or less hours a week. I have nobody full-time equivalent anymore. Well, that raises some discrimination issues. That also raises productivity issues. That also raises competitive issues. I'm flying to Florida tomorrow to go meet with a large self-insured group. They're in the waste management business. Their employees make minimum wage. Perfect group to say, we'll just hire more people, it's manual labor, and we'll reduce everybody to 29 hours. Believe it or not, the market in South Florida right now for minimum wage laborers is so hot, they can't do it because they'll lose their people. Because other firms, smaller firms that are less than 50 will gobble them up. And they can get 50 hours from the small employer. Competitive situation. This company also looked at opting out of insurance altogether. They were looking at a $6 million non-deductible excise tax. We're stuck in health insurance. And we've got to help this group figure out a way to manage that expense. Part-time employees, again, IRS closed that loophole. Also, for all intents and purposes, it's a 2-to-1 ratio. For every 2 part-time employees, they equate to 1. So even if you're a company that's on the cusp, maybe of 55, 60 employees, you could probably play around with these figures a little bit. Anybody above that, you're playing. Otherwise, you're looking at the penalty. Here's the other thing that we have happen. What's the third thing that always came up when the bill first came out? I'm taking my son, I'm going to set up a new corporation. I'll put 20 employees with him, I'll take 40 employees, I'll put another program under my wife. I'll have 3 different companies. What does it make a difference? Can't do it. Okay, they closed that loophole too. Anybody's familiar with IRS Section Code 414? Goes into great detail. There's really, for all intents and purposes, there's 3 different types of control groups: brother, sister, parent, subsidiary, and affiliated service groups, which gets into the employee leasing PEO world, co-employment. A lot of uncertainty in that market. A lot of PEOs are coming to us, asking us, what are we supposed to do? How are we supposed to manage this? Again, I'll give you some examples. Here's something else that's very interesting that we rarely see the media talking about. Everybody knows that we have an uninsured problem in this country. We also know we have a lot of illegals in this country. For anybody to get access to insurance through the government exchange, your information now goes Homeland Security, IRS, Social Security, and the Department of Human and Health Services. There's a reason people are off the radar. We are talking to other groups. We have low-wage people. We try to help them get onto Medicaid. They tell us Medicaid is too intrusive. It's 30 questions to get into Medicaid. Are those people now going to go through this exchange and find out that I have garnishments that haven't been collected? I have an old lawsuit that I walked away from. I have a car accident that resulted in a court action that I walked away from. I was arrested in the past for something. I owe my ex-wife money. I have child support. Do you think those people are going to go through the exchange? We're still going to be stuck with an uninsured problem. And unfortunately, the uninsured are the ones that go to the most expensive access points in the healthcare system. We'll see how this plays out. Let's talk about an exchange. It's the word that the government is throwing about, and they've actually changed it. They don't want to use the word exchange anymore. They found that when you convert it to other languages, there's some negative connotations to it. So it's now called the marketplace. What I tell people is, I'm the physical embodiment of an exchange. I've been doing this for a number of years. I go out to my clients. I evaluate their circumstance and their situation and their goals and needs. I go out to the market. I do a full analysis of what's available for them in the market. I come back and I present a number of options. We work together to pick the one that works best. I'm an exchange. We've been in existence for a really long time. The government thinks they could do a better job and do it completely online. That's an exchange. For small businesses, the government is making it highly attractive for companies to go through the exchange through a tax credit, which I'll talk about in a minute. Large companies do not have access to the government exchange, but large companies are setting up their own private portal, their own private exchange, private marketplace. They're just taking advantage of technology, is what they're doing, and putting all the options where in the past we would do on-site education meetings, now we just do everything online, through webinars and taking advantage of technology. What can I sell through an exchange? The government exchanges are going to sell medical only and some pediatric dental and vision, but employers can use this exchange technology, and we've developed 2 exchange platforms that we're rolling out. We can add all of these different benefits. If anybody in this room is familiar with the all cafeteria plans, so that was the buzzword from the 80s, the 90s, was cafeteria plans. This is a cafeteria plan, except it's web-based. Only difference. I won't spend too much time on this, but the reality is these individual exchanges that are coming out, the pricing of them is going to be high. And truly, the only way it's affordable is if I'm subsidy eligible. If I'm subsidy eligible as an individual, it'll probably cost me less money to buy my insurance through the exchange. Again, assuming I'm not Medicaid eligible, assuming I'm not Medicare eligible. The problem with this is, and this is again another analysis that we believe an employer should do, and we believe is our responsibility to our clients. We now have to talk about pre-tax and the post-tax world. If I'm an individual and I'm covered through my employer right now and they're taking $200 a month out of my pay, they're probably taking it out pre-tax. It's only costing me about $130 in take-home pay. If I look at the exchange, at first glance, we look at this one example right here. This employee would pay, well, it's a little bit too high. Let's say I had $300 out of my pay, okay, through my employer. And I look at this and say, oh, this only cost me $265 out of my pay. The difference is you go through the exchange, it's post-tax. The government's taking away the tax advantage. Okay, analysis has to be done at every level. And unfortunately, a lot of employees, as we know, are not the sharpest tools in the shed. They're going to need our help. Again, just another slide that talks about the small business exchange of what's available. And like I said, the most important thing for this is if I'm an employer beginning in 2014 and I want to get a tax credit for offering insurance to my employees, I have to go through the exchange. Okay? But please keep in mind that the exchange is just one access point to obtain insurance. Any company, small or large, still has access to going outside the exchange, can still actually develop a program that does not meet the affordability requirements, can still develop a plan that doesn't have all these minimum benefits included in the program. Analysis has to be done, but there's actually more choice if you look outside of what the government's proposing. Self-insurance is becoming more and more popular. More and more companies are going into the self-insured route. Just the thing to remember is you need the analysis to be performed. The government came out with this tax credit. Just very quickly on the tax credit, I need to be a business with less than 25 full-time equivalents. My average wages have to be less than $50,000. I need to contribute 50% of the premium, and then I get a credit. The problem is, these are the estimators that we see on the web. These are the estimators that even the state exchanges are using. Captures 4 variables. There's actually 20 variables that go into the formula. If you only use the 4 variables, it minimizes your tax credit. It follows the IRS rule. There's 3 different ways to calculate this. I know it's a lot on the slide. This is our version of the tax credit. We take all 20 variables into it. We maximize the tax credit. This is a small client. We use the IRS method. Their tax credit was $5,360. Doesn't sound like a lot, but it's a small company, only 7 employees. We ran the same exact figures through our calculations. We were able to almost double the credit, $98.96. You've got to dig deeper. The analysis has to be done. Summary. Made everybody feel good, right? How's that dessert? Just very briefly, we broke everything down into 4 different components that every employer has to do now, okay? There's notification requirements they have to give out to all their employees. There are taxes, there are new payments, and if I'm a small business fully insured, I'm paying it through my insurance premium from my insurance company. I have all this new reporting that I need to track, and I need to make sure that I'm offering the right benefit program to avoid penalties and taxes. And the last thing on that piece is the government just came out last week and said they're going to use an old penalty provision from ERISA, which is basically saying for every component of this law that a group is not in compliance, $100 per day per employee. So, action items that we're recommending for small employers, again, just talking about groups less than 50. Calculate if they're eligible for the tax credit. They've got to determine what are they going to do with their employee makeup. Do they adjust the hours worked? Do they lay people off? It's a big question. Do I stay underneath that 50 threshold? And if I do, how do I divvy out the work? Do I continue to offer insurance? If I do, then where do I go to get the insurance? If I don't, am I going to have those employees lined out my door saying, you just cut my insurance out, you used to contribute $500 a month towards my insurance. I'm going to get that in a raise, aren't I? All these questions and all these new conversations that every employer needs to have. I need to reevaluate my contribution strategies. Did I used to do a percentage of premium in the past? Maybe I need to go to a flat dollar amount. What if I only focus on the employees and the dependents, not spouses? The government left that piece out. Employers no longer need to contribute towards spousal coverage. I've got to calculate pre- and post-tax implications. How am I going to get this information out to my employees in a manner that they can understand it and make the good decisions? What type of access am I going to give my employees? And am I going to meet all the compliance requirements? And oh, by the way, I still have to make a living. I still have to make sure revenue is coming into my business so I can keep my employees. Large employers, many of the same things, but large employers have bigger implications because they have the penalty provisions. But in many respects, they have a couple more options. What type of funding? Do I stay fully insured? Do I go completely self-insured? Do I do a modification of those? Health reimbursement arrangements, health savings accounts, maximizing those. What type of educational outreach program am I going to introduce? How do I track all this activity? How do I do all these calculations? How do I do this monitoring? And how do I get it reported to the government in the way that the government requires it of me and minimize my penalties? A lot on everyone's plate. That's my presentation in a very short, abridged version. Any other questions? Yes? 1099s are independent contractors. I'm sorry? You are not responsible for 1099s. What we're finding is a lot of companies are trying to take their W-2s or continue to try to outsource to go 1099, and the response that we get from everybody? Okay. And the response we get from everybody is, but I have an agreement. I had that 1099 person sign an agreement. Well, sit at the next New York State Workers' Comp audit, and you see how fast they turn those 1099s into W-2s. And then you get hit with a retro penalty and taxes. And that's what we're seeing. I've been told that my time limit is up. Again, we'll be here for about an hour after this. Anybody has any questions, by all means.